so one of our exercises that we see that is really hard for people to understand is getting true hip extension. True hip extension is challenging because if you're not locked into a pattern or a position, you're always going to use your lumbar spine or the low back to get that extension. So we try to set up patterns or a position that we can lock out lumbar spine as much as possible and then work on hip extension. The funny thing is it's going to look like my hip doesn't really extend, but truly it's only hip that's moving at this point in time. So we're going to use a box with a little bit of a pad, just a little bit more height, and we're going to round ourselves over this box to get that lumbar locked position. All right. And we switch legs. Okay, so that is one version. Let's show you another one. Actually, I'll show you two others in case you don't have the equipment like this at home. So, okay, so if you have a med ball or even an exercise ball and you can round yourself over that ball, you'll hold that blow into your gut here and make yourself a little ball and then extend the hip. Okay, there's that one. And again, if you don't have equipment whatsoever, get into a, make yourself a little ball again, but then extend one leg out behind you. So we'll go, right leg is flexed or hip is flexed, rounded, and then extend the hip. There you go. So 3 ways to work on hip extension in a flexed spine position.